third type of diabetes is the one we're more familiar with. It has become more common, and that's adult onset diabetes. There's so many different causes to this condition, from high blood fats, known as triglycerides, or blood foaming, weak insulin factor, weak glucose tolerance factor, GTF, are a few of the more common reasons why diabetes 2 occurs. I want to reemphasize that in diabetics, sugar consumption should be monitored relatively well, but in this case what we're going to do, there are tricks to seasoning, or actually sweetening the apple pie, rather than adding the typical white sugar. Sucrose is an example, and we'll show you the difference with that. So what I'm going to do is I'm going to roll this a little, because we're going to need probably a little more room to peak the crust. As you'll see, it'll have a peak to it, obviously, with the mound here of apples. Okay. And let's see how we're doing here. Let's test this out. What I do is I fold the crust to put it on, and I think we're going to be okay. Seasoning mechanisms, black pepper. Now, once again, we discussed black pepper, extremely important because of the high amounts of vanadium. Sure. And now we're going to turn it off, take it off the... That's all we do here. In this case, it's about 2.5 minutes. And as you can see, the spinach still has a relatively green, and it hasn't been boiled down enough or reduced enough to where it's just basically a floppy mess, as many of you have seen with spinach that's overcooked. So with millet, it's a good idea to periodically check it after a half hour. And what you want is just to feel the bottom of the pan start to stick, just at that point. And we've reached that right now, actually. Now, some individuals would like to cover it. If you like your broccoli cooked a little longer. Other people, if you leave the pan uncovered, it generally retains a more crisp texture to it. Another thing with diabetics, it's to be aware of predispositions or conditions that could occur, is the urine when it's observed in the toilet bowl, how the sediment, it has a higher sediment value to it. We refer to it as specific gravity, but basically it can be visually seen often. And that's another clue. So that's the celery. Now with the potato, what I do here is I'm going to use a cutting board. And how I like to do this with soup is to cut lengthwise. We're going to do both potatoes here. And once again, leave the bowl uncovered because we don't want to reintroduce moisture. We want to keep this as dry as possible. We can almost consider that this can be almost like a supplement for diabetics. Not is it just eating food, but it's also supplying certain components, elements, amino acids, that actually begin to help diabetics and diabetes itself, type 2. Number 2 is to increase something we call a glucose tolerance factor, which is important because it helps to function primarily to assist and to enhance the way insulin introduces glucose into the cell.